Welcome, everyone. Hello, my name is Tiffany Dzierman-Strzycki. I'm the Community Relations Manager for the Rochester Hills Public Library. I'd like to welcome you to this evening's program, Managing Anxiety and Depression During Unpredictable Times with Ascension Providence Rochester Hospital. Thank you for joining us. I would like to thank real quickly the Friends of the Rochester Hills Public Library for supporting our programs through their fundraising efforts. And tonight we'll get started, so I'll turn it over to Stephanie.
Thank you, Tiffany. So hello, everybody. My name is Stephanie Bauer. I'd love to see there's like 19 people on tonight. So thank you all for coming. I am a nurse coordinator in the Community Health and Education Department at Ascension Providence Rochester Hospital. So thank you for joining us for this evening's presentation on managing anxiety and depression during unpredictable times.
May I have your attention, please?
Sorry, as I'm in a hospital, there's a little bit of an announcement overhead. My apologies. So this presentation is part of our Your Mind Matters series. And I also want to thank the Rochester Hills Public Library for hosting this virtual presentation. This partnership has been just so great to help us connect with more members of our community. I want you guys to know that we're going to be using the Zoom chat feature so that you can ask questions during the presentation. So go ahead and I will start that chat once we get started with Paula tonight. Go ahead and put those questions in there. I will collect them and then read those to her at the end of the presentation. We're also going to be able to unmute ourselves after her presentation. And you can, if you'd rather ask her questions yourself, you're welcome to do that as well. So whatever your comfort level is. So now I'd like to introduce tonight's presenter, Paula Leapheart. She holds a bachelor's degree in psychology and a master's degree in mental health counseling. She is a licensed professional counselor and a certified advanced alcohol and drug counselor. She began work in the field in 2010 at Moore Counseling and Meditation Services in Euclid, Ohio. She started as the receptionist, and just a few months later, she was a certified chemical dependency counselor assistant. Under the leadership of her mentor, Dr. Martina Moore, she learned a wealth of information and continued to advance in her career and began working with individual clients. In 2015, she moved back to Michigan and began working as a full-time therapist in Ann Arbor Comprehensive Treatment Center. And then after that, she was promoted to the role of clinical supervisor in 2017 and began working in private practice as an outpatient therapist. Then this June 2010, she became a proud member of the Ascension Eastwood Clinics team as a behavioral health supervisor. At Ascension Eastwood, she works with a team to diagnose and treat a wide range of mental illnesses, and their team cares about how these disorders may affect physical and emotional health and offer programs to address complications linked to mental illness, including drug and alcohol addiction, family conflicts, and social isolation. They pride themselves on being available to listen and understand, and together they strive to deliver a care plan that addresses prevention, interventions, treatments, and recovery support services. So now let's welcome Paula Leapheart.
Thank you so much, Stephanie. Can you guys hear me now? No?
I can hear you.
You can hear me? Okay, perfect, perfect. Thank you so much. Welcome, everyone. Thank you all for joining this evening. As Stephanie mentioned, my name is Paula Leapheart. I'm so happy to be joining you guys here this evening. We are definitely living in a different time where there is an uptick in anxiety and depression and a lot of other mental health illnesses. And while it may be challenging to manage these issues on a day-to-day basis, just, during normal years, 2020 has definitely been a very different year for us. And so we thought that it was very important to be able to address this, to give people some of the tools that they may be able to use to work to be a little bit healthier. So let's see, anxiety and depression. I'm sure all of you guys have heard both of these terms time and time again. I'm sure you guys can think of times in your life where you've probably experienced one or the other, if not both, as well as times where you thought you were experiencing one or the other, but maybe not wanted to actually admit it. So let's think back to times maybe of, let's say, elementary school, middle school, first day of school. It's time for you to get ready to get up and go. Your stomach is a little queasy. Your hands are a little bit sweaty. You're going into a brand new environment and you don't really know what to expect. Brand new teacher, brand new classmates, and you just know that there is something on the other side of this that's kind of unpredictable. You're not actually sure how this is going to turn out. And so your body responds in a way to where you feel anxious. While normal is still something that, we do experience and must be addressed. Same thing with depression. There are different times in our lives to where we can think back to specific situations or occurrences to where something transpired in our life where we experienced an increased amount of sadness, and it probably lasted longer than what we were normally accustomed to. So let's talk about these two things in detail. So anxiety, what is anxiety? Anxiety is a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. So just as I stated, something that we don't really know what's on the other side of this event. We don't really know how this is going to turn out. So we're feeling nervous about the situation. We're a little worried about the situation, a little bit on edge because we want everything to turn out right, but we know that we're not 100% in control of everything that happens. So some of the symptoms of anxiety, you may feel nervous or restless, have some difficulty, difficulty concentrating, or your mind going blank, increased heart rates, sweating, feeling weak or tired, having trouble sleeping, having difficulty controlling your worry, and having the urge to avoid things that trigger anxiety. So there are other symptoms, of course, but these are some of the main ones that probably come to mind when you think about feeling anxious and really, really dealing with anxiety. So how does anxiety actually affect us? What happens when we feel anxious? How does it affect our daily life? Well, unfortunately, one of the biggest things that we try to do is avoid. We will avoid person, place, thing, and anything else that we can to try to stop that anxiety. We struggle with irrational thoughts or overthinking. And when that happens, sometimes if you're feeling anxious, your mind will overthink and overthink and overthink and drive you to a place to where you realize, wait, how did I even get here? Where did these thoughts come from? And sometimes you'll realize that what you're thinking is completely irrational. That is another symptom of anxiety. Sometimes there's fear that will set in because, again, we're not in complete control of everything that happens. We become fearful because we don't know what the outcome is going to be. And again, we're only in control of a small part of this bigger picture. So when it comes to managing anxiety, I would say the goal of managing anxiety is to reduce the overall frequency, intensity, and duration of the anxiety so that daily functioning is not impaired. So if by chance you say, okay, I'm feeling anxious, I've been struggling with this for a long time, let me go see someone. Let me go see a mental health professional. Let me go to a therapist or a psychiatrist or even a psychologist, somebody that can help me to be able to work through this anxiety that I've been feeling. Some of the things that a therapist or a professional would work with you on are being able to identify the triggers of anxiety. So we may ask, because I'm a therapist. So if someone comes to my office and one of their chief complaints is really being anxious and struggling with anxiety, I'm going to ask them to identify the triggers of anxiety. That's going to be one of the first things that we're going to focus on, because we need to know what's causing you to feel anxious. And so once we know what's causing the anxiety, then we can try to learn how to cope with it or different ways to deal with it. So when it comes to the triggers, you may say, every time I wake up, I'm feeling anxious now. And we'll talk about, okay, well, what's the first thing you do when you wake up? What's going on in your day? And we'll be able to see what is actually causing the anxiety. And it may be that you just started a brand new job. And so every morning when you wake up, you realize I have to go to work today. And so that's a trigger that's causing you anxiety. So that's one of the things that we would address. Number 2, learn and implement calming skills to reduce the overall anxiety and manage anxiety symptoms. Learning calming skills is extremely, extremely important. If you've ever experienced anxiety, you know that the symptoms include sometimes, your heart beating faster, becoming sweaty, mind going blank. You really, really want to try to calm yourself down as much as you can. You want to try to bring yourself back to a place where you can be relaxed, if at all possible, but really, really just try to center yourself and get to a place where you're having, you're taking deep breaths and you're just in a place to where you can function a little bit better and not allow the anxiety to overtake you completely. Number 3, gain an understanding of the roles that cognitive biases play in excessive irrational worry and persistent anxiety symptoms. So this again is what I was just talking about when I talked about the irrational thoughts and overthinking. You want to try to make sure that your thoughts are rational. You want to stop and ask yourself, wait a minute, am I spiraling right now? Is this really rational? Are my thoughts rational or am I going overboard? Ask yourself those questions. And there's a pretty good chance that you'll be able to bring yourself back to a rational state if you're able to just stop, take a deep breath, and think about what's actually going on. Number 4, identify, challenge, and replace biased, fearful self-talk with positive, realistic, and empowering self-talk. We all know that while we're not in control of everything that goes on around us, we're in control of ourselves. We're in control of our minds. We're in control of our bodies. If you think positively and if you try to refocus yourself, you'll have a positive outcome more than likely. If you're in a situation to where you're feeling fearful and you have all these negative thoughts, the more negative thoughts you have, the worse off you'll be. It may take a minute to try to flip that switch and get to a place of thinking positively, but it can happen. You just have to remember that you're in control of your own thoughts, and whatever you think is what will help you to actually calm down and be able to regroup and refocus in the moment. So those were like the clinical, the clinical terminology and the things that a therapist would use or help you to try to, get back out there and minimize your anxiety, be able to manage it and things like that. In the event that you're just doing all this on your own and that was too much terminology for you, these are some just simple skills for just the everyday person to just be able to manage it on their own. Of course, number 1, you can go to therapy, but outside of that, breathing exercises and techniques, yoga, meditating, things like that, deep breathing, it really, really helps you. It helps you to calm down. It helps you to stop in the moment because sometimes we just have so much going on and we're so focused on getting to the goal or to the end, we don't stop in the moment. So if you try to just stop in the moment and try deep breathing, you may actually be able to calm yourself down some. Healthy coping skills such as exercising or walking. Exercising and walking are 2 really, really good coping skills. Exercising and walking are both stress relievers. They help you to feel better physically. They help you to be healthier, of course. And then they also help you to clear your mind. Some people enjoy walking or exercising with music, and so listening to something that may be a little bit motivational or inspirational, that can all help you. The relaxation techniques or meditation. And then number 5, planning ahead. If you know that you struggle with anxiety, give yourself a little bit of worry time. Because you know that if you're going somewhere, you're anxious about where you're going, you're going to pull into the parking lot, you're going to need an extra 5 minutes before you get out of that car. And that's okay. Know yourself and give yourself that extra time because that's what you need to be okay. And then remember, 1 step at a time and staying in the present moment. You won't always be able to figure everything out from the very beginning. You don't know what the outcome will always be. But if you stay in the present moment, you're able to handle what you're feeling right then and not try to handle every single thing that's going to come afterwards. Depression. What is depression? Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Some of the symptoms include feelings of sadness or hopelessness, crying spells, angry outbursts, irritability, loss of interest or pleasure in most activities, sleep disturbances, lack of energy or motivation, and changes in appetite. Now, I'm sure we've all experienced, you know, one or two of these symptoms at some point in time, or maybe all of them. It just depends on the person. And sometimes it comes out of nowhere. Sometimes we can see it coming. But regardless of how it comes on, it's a very serious situation. And it's definitely something that we should not let go unaddressed. How depression affects us. One of the biggest things that many of us do if we become depressed is we isolate. Unfortunately, we find ourselves being more ashamed that we're depressed than in a position to where we want to seek help and get better. It's very difficult because sometimes we actually feel guilty that we're depressed. I should be healthier than this. I should be okay with everything that's happening in my life. I'm strong. I've always been able to bounce back. Why me? Why am I feeling this? So because you're going through all those emotions and you don't know how to get well yourself, you'll isolate. You don't want anybody else to know that you're experiencing this. So you stop going to family functions. You stop hanging out with your friends. You stop answering your phone. You're calling into work if you can. And even if you can't make it to work, you make it there and right back home into the bed, because isolating is the best thing that you know how to do. You experience loss of interest in activities. All of a sudden, you don't want to go anywhere anymore. You don't want to go to the parties or to the friends' houses or to, the celebratory events. You're not interested in doing any of that. And even when you push yourself to go, you're still not really there. You're just physically there. It affects our relationships. Say you have a partner or a significant other, it definitely affects the way that you guys are able to coexist and behave, because you're really not yourself. And so it's a good chance that they may pick up on the depression as well. It definitely affects our health, because some of the symptoms are loss of appetite, insomnia, not being able to sleep. You may find yourself, not being able to eat or function as well. And so then you find yourself losing 10, 15 pounds without trying. It may feel good for a second, but then you realize, okay, but the weight keeps coming off because I really don't have an appetite. That's not healthy. And then it can affect our careers, because again, in the beginning, we may push ourselves to go. We may push ourselves to go to work, but if the depression gets too bad, you will find yourself calling in more and more because you just can't get out of the bed. So how do we manage depression? We manage depression by alleviating the depressed mood and trying to return to the previous level of effective functioning. So again, if you were to go see a therapist, these are specific things that we professionally would try to work with you to achieve. So we would ask you to think about current and past experiences with depression, complete with its impact on function and attempts to resolve it. So we want to know about your history. We want to know if this is something that just came on. Is it something that triggered it? Where did this come from? And how have you handled it before? Were you able to just snap out of it? Or did you go see another therapist before? Were you medicated? What helped you in the past? Let's see if we can get that to work again. Identify the source of the depressed mood. It's so important if you can't identify the source, because if we know specifically what's causing it, we can learn how to process that particular thing and work through it with you. Identify and replace cognitive self-talk that is engaged in to support depression. Again, what you tell yourself is so big. If you're not thinking positively, you can almost guarantee that nothing positive will come out of the situation, or that you'll be able to get to a positive place. So you want to be careful about the thoughts that you have. And I know sometimes it's hard when you are depressed, but try to remind yourself, let's speak life. Let's think about positive things instead of all the negative. And then number 4, increasingly verbalize hopeful and positive statements regarding self, others, and future. So again, just trying to be hopeful, trying to find that way that you can be positive, find those hopeful statements and those things that you can really hold on to encourage you and motivate you to try to move to a healthier place. So again, therapy it'll always be my first go-to, because I'm an advocate for therapy. I believe in taking care of yourself and trying to better yourself. And sometimes we need somebody to hold us accountable, and we need somebody to walk through those steps with us. So if you can, seek therapy. If you're doing it on your own, you may want to try to start setting small goals to re-engage in activities. You won't feel like going to do everything. That's just the honest truth. When you're struggling with depression, you don't feel like doing anything at all. But try to get yourself up to do one thing, even if it's one thing a week. Try to engage in one activity per week just to get you back out there. Practice self-care. It's so important. You have to take care of yourself. If you don't take care of yourself, you can't take care of anything or anybody else. Build a support network. While it's difficult because you feel like you're forced to isolate because you're trying to hide, start talking to the people that you trust. Know that if they love you, they want you to be okay. They want to be there for you. Give them that access to you and to your life so that you can heal and get better. They can hold you accountable, but they can't hold you accountable if they don't know. Reduce your stress. If you can pinpoint specific things that are causing you stress, try to minimize it and reduce it as much as you possibly can. This one may seem odd, but maintain household chores. As difficult as it may be to get up and sweep them off the floor or to do the dishes or to do the laundry, I promise you, coming into a house that is well kept will create less anxiety and will actually make you feel better versus coming into a home that's not kept and just feel like everything is in disarray. And then remember, of course, one step at a time. At the end of the day, these are major, major things that we struggle with. You're not going to conquer every single thing all at the same time. So if you can pinpoint one thing that you can do today and one thing that you can do tomorrow, and you can commit to those things and achieve those things, you're still headed in the right direction. So specifically, we wanted to kind of address unpredictable times, how to manage anxiety and depression during unpredictable times. So a few unpredictable times that I thought about were holidays. Those are approaching. And while we know that holidays come at the same time every single year, the environment can be unpredictable. If you're not that close with your family and you guys only get together on the holidays, you may experience a little bit of anxiety because you're going into this situation that's a little bit uncomfortable for you. It's not something that you're very familiar with, but you're forced to do it every single year. And so you try your best, but the situation can still be a little bit unpredictable for you. Grief and loss. When we lose loved ones, we never know how we will respond or react to that loss. That is unpredictable. A job loss. Even if you know that things aren't going extremely well, we always want to hope for the best. So if we lose a job, we're still not sure how that situation is going to play out completely. And then, of course, the biggest situation that we're dealing with right now is the pandemic, COVID-19. This is definitely an unpredictable time for us. What we can remember is that we've come from March to November and we're still here. Many of us have lost people along the way. Many of us have experienced some type of job loss, grief and loss, anxiety, depression, some form, some way, one way or another, you've been affected by COVID-19. We all have. However, with following some of these steps and working through some of these things, we're able to be a little bit healthier, even in the midst of the pandemic. So, managing anxiety and depression today, what are some things that we can do? We definitely want to limit the amount of information that we take in. Back in March and April, all we heard about was COVID-19. It was on the news every day. It was all over social media. It was on every radio station. We were being swamped and bombarded and flooded with information about COVID-19. It changed from day to day because we really didn't know what we were dealing with. We have a little bit more information now, but things are still up in the air. We still don't have a complete grasp on this situation. So I urge everyone to limit the amount of information that you take in so that you are not completely overwhelmed. Maybe you should only check social media once a day. Maybe you should listen to the news once a day. Whatever you feel like is going to be best for you, that's what you try your best to do. Credible sources only. I cannot stress this enough. Social media is not a credible source. Oftentimes, we have people that we know that post things and then somebody else shares it and then somebody else shares it and then somebody else shares it. How many of those people do you think actually took the time to fact check what they shared? Not many. So be careful about what you take in and what you actually believe. Number 3, controlling what we can control. We are not in control of COVID-19. We are not in control of who catches it, who passes away from it. We're just not in control of it. All we're in control of is ourselves. And whatever way you can control yourself is what you do, and that's what you focus on. Number 4, becoming creative with social distancing. Now, when the weather was a little bit nicer, there was a lot of things that we could do. Going outside, taking walks, doing whatever you can. Now that, the weather is going more towards, the fall temperatures and things like that, we'll be heading into winter soon in the next couple of months. We still have to become creative because we don't want to isolate fully. We don't want to shut down. We have to keep living. Find, a time that you guys can schedule to meet with family on Zoom. Do some family video times, do some games on, Zoom, things like that. Become creative so that even while you're social distancing and staying healthy and safe, you're not disconnecting from your loved ones. It's very important that we really, really build a support system in the midst of all that's going on. Self-care, again, if you don't take care of yourself, you can't take care of anybody else. You have to make sure that you take care of you. Avoid the use of drugs and alcohol. Of course, there are recreational drugs that people engage in. There are, alcoholic beverages that people enjoy socially and things like that. Be careful about the amount that you're consuming right now, just because we all know that mood-altering substances are called mood-altering substances for a reason. They alter our mood, they alter our mindset. We want to make sure that we're in our right mind and able to handle the things that come up on a day-to-day basis right now. 7 and 8, regular exercise and healthy diets. Again, that goes back to self-care. You want to make sure that you're healthy as much as possible. So the things that you can control, try to control them. That's exercising regularly and eating a healthy diet. Those are definitely 2 things that you're in control of and that can absolutely make you feel a lot better. In the event that, you guys do want to seek therapy in any way, Ascension Eastwood Clinics is available all the time for any services for mental and behavioral health. We have a variety of locations. Right now, we're doing virtual therapy. So honestly, any clinic that you choose to go to, you can just, schedule a virtual appointment. Even if you want it in person, we have clinics all over. So it's a lot of different options based on what you're looking for, based on location, based on insurance, no insurance, all of that. You can always reach out to us at any given time. I did paste put the website there. And if you go to that link, you just click on specialty care, and then you click on behavior and mental health, and the Eastwood Clinics will come up. So I'm going to stop sharing my screen and let's see what we have in the chat here.
Yeah, we just had a question come in, Paula. Do you have a recommendation regarding panic attacks?
Panic attacks, definitely want to try the relaxation techniques. Panic attacks, they're very difficult and challenging to deal with. But as long as you know, again, what's causing the panic attacks, like if you know particularly what's causing the panic attacks, you want to try to work through that, avoid it if you can. If you cannot, then definitely try to calm yourself down. Try to focus on the moment that you're in and not 5 minutes from then. It may be too much for you to handle the next 5 to 10 minutes while you're experiencing that panic attack. So really just try to focus on the moment that you're in, the here and now, and get yourself back to a healthy place, and then you can continue on with your day.
Okay, great. So I have a couple of questions. When do if you're struggling with either anxiety or depression, what kind of is the telltale sign that you need help from a therapist? Is there something that you can give that's more concrete?
Yes, I would definitely say if you are finding yourself, especially with depression, we all experience sadness from time to time. There will be a bad day or, life that just happens. If you find yourself feeling increasingly sad over, a course of several weeks, and especially going into months, you definitely want to reach out for help, because that's more than likely is more than you just being sad. Even if you can pinpoint what it is, at that point, you should probably seek professional help so that you can get help with working through the issue. If you can work through it within a couple of days on your own, or maybe even a week or two on your own, then that's great. But if you cannot, and you find that it's lingering quite a bit of time, then you definitely want to reach out to get some assistance.
That's very helpful. Very good. Do you have any recommendations for how you can support a loved one who's struggling? I think sometimes it's hard to know what to say. Do you have any advice on that? Yes, and that's really good, Stephanie. Thank you for that. It can be very difficult to know what to do or know what to say. The biggest thing is to be empathetic. You may not understand it personally. You may have never experienced it. But again, more than likely, they're already probably bothered by the fact that they're experiencing this anxiety or depression. They may be a little bit embarrassed. They may not even want to admit it. And so I would say, try your best to create a safe space for that family member or that friend, and try your best to really, really be empathetic and be that good listening ear for them and not be judgmental, because they'll definitely shut down. Right, for sure. Something came to mind is, I know a lot of people believe in essential oils and using them for mood enhancement. Do you have any advice on that? You know what? Honestly, I've heard that it works for many people. And if that's something that, someone tries and they feel like it actually works for them, or it lifts their mood, or, I think it goes back to what works for each person. Some people, they can just come in and light incense or burn candles and it literally lifts their mood. It's real, and if essential oils help, that's awesome, because that's something that you can just do on your own. You can go and get them and you can utilize them, how you see fit. Sure. Yes. Sure. So can someone get started, like at the Eastwood clinics, as a new patient and start virtually? Or do they have to be an established patient? Nope, you can call anytime. In any of our locations, you can call. They'll ask you a couple of intake questions just about, what you want to be seen for, kind of what you're experiencing, what type of insurance you have, if you have some, or, the cash rates, and you can get started right away. We're always accepting clients for virtual appointments, and we're even doing some in person. So we are doing some in person. Now, as the numbers continue to go up, I don't know if if we'll go back to doing 100% virtual. I'll say about 90% is still virtual, but here and there we have, especially for like our teenagers, our children, it's kind of hard to do virtual therapy with them. So we are really seeing them more in person for sessions. Gotcha. Yeah. So there's a question that just came in on a medication. Do you find that drugs like Lexapro need to be increased over time? So it's a question that's better for a psychiatrist. I will say this, it depends on the person. It depends on, and this is with any medication, it depends on how long you've been taking it. If you feel like your body has become kind of immune to it, or you've built a tolerance to it, you need an increase in any medication over time. But I always recommend, if you're being put on medication, try talk therapy as well. Because if you ever decide that you want to stop taking the medication, you still want to have the necessary coping skills and techniques to be able to sustain this new lifestyle that you created. Right. Let's see, if there's anything else that comes to mind. Any advice for parents whose maybe teens or preteens are having some symptoms, like what they should do first? I would definitely say keep an eye on the teenagers right now. We are seeing a huge increase. I know on my caseload personally, I have a ton of high school students, young adults right now struggling with anxiety and depression, even just because of virtual school, not being able to get out, not being able to see their friends. So I would say, please pay extra attention to the teenagers right now, and even the younger children. They need a little bit more love. They need a little bit more support. They need to know that their feelings are real, and they need to feel validated, because some of them feel like, my parents don't really understand what I'm going through, and they think that I'm exaggerating. I am sad all day long, and I don't know why, but this is different for them. Summer vacations are one thing, but to be out of school from March until November and then December, it's not fun for them. And the virtual experience is the best that we can do, of course, right now, but they are struggling a lot. For sure. for
Yeah.
sure. Well, I think I'm going to check the chat one more time to see. It looks like something came in. Is there any advice for a person whose spouse is being treated for possible Alzheimer's?
I would say with that diagnosis, a caregiver needs to make sure that they take care of themselves for sure.
Right.
That can be a lengthy journey. Is something that I've actually experienced personally, not with the spouse, but with a loved one. And it can be difficult to watch. So I actually recommend, when going through that type of life transition, that the caregiver is seeking therapy for themselves. You're going to need support. You're going to need an outlet, and extra patience, because the person with the diagnosis is not really in control of their day-to-day. They're not really in control of, how they feel all the time, or what they can remember, or what they don't.
Okay. Thank you. Looks like we're getting a couple more questions. So
Yes.
is there any advice you can share for someone whose anxiety affects their mobility and daily life activities, such as panic attacks while driving?
That's a good one. I think really when working with that, with something like that, you really want to be focused on your irrational versus rational thoughts, because oftentimes panic attacks while driving and even anxiety that affects your daily life activities to an extreme, it may be because there are some irrational thoughts that are going on there. And so we really want to pinpoint what's triggering it and how to counteract those thoughts. So if it is a situation like I had someone who used to be extremely fearful of driving just because they felt like they were going to get into a car accident all the time. Like they just felt closed in and caged in. But not only a car accident, it was, I'm scared to drive because I think someone's going to hit me and then I'm going to die. And then who's going to take care of my kids? And then it's like that spiral effect. And so really trying to stay in the moment and focus on what you can control, making sure that you're prepared, you're not distracted, you're in control of you and your vehicle and your car, and remembering that accidents are rare, that there are many people who get in the car every single day and they drive and they're perfectly fine, and they return back home the same way that they left. And so really just trying to remain calm and work through those rational versus irrational thoughts, even before getting behind the wheel of the car, can be helpful.
Okay, very good. Let's see. Someone asked, how does one get motivated to do things? Do you have any recommendations on how to motivate yourself?
I always say, ask yourself the why. Why do I need to do this? Why do I need to do that? Why is this important? And when you know the why, oftentimes you'll find reasons to be motivated, and then you'll feel like following through with whatever the task is. Gotcha. So, if say, you want to, your doctor says you need to lose weight because, you're on the borderline of being, pre-diabetic or something like that. Well, I'm not really motivated to exercise or work out or eat healthy. Why should I? Well, do you want to live? Yes, I do. Do you want to be healthy? Yes, I do. Focusing on the why will motivate you a lot quicker than other things.
That's very good. Like that. So I think we all need that. I think that's a common struggle.
Yes, focus on the why.
Yeah, for sure. Now, do you have any, what kind of relaxing exercises do you recommend for teenagers?
Deep breathing. And I really, really like guided meditation. Teenagers and adults as well. And honestly, you can find those on apps. You can find them on YouTube. You can literally type in guided meditation on YouTube and a bunch of stuff will come up. Mm-hmm. And you can also download apps and it'll, just guide you through the meditation. It'll tell you exactly what to do. And then from there, you can just start trying to do it on your own, because then you understand the concept and what's actually going on, what the process is.
Gotcha. Very good. Now, I was told that anxiety is contagious. So is that true? Could I live with somebody who's anxious and then become a more anxious person?
I'm not sure that it is contagious. I do think that we pick up things from our environment. If you think about children and the way that they're raised and they grow up and we say, you act just like your mom, or you act just like your dad. Some of the things are genetic, yes, but some of the things are just learned behaviors. And so I do believe that if you live with someone long enough, sometimes you pick up their traits and their habits without even realizing it. So I think it would be more so that than it necessarily being contagious,
Gotcha.
so to speak.
Right, for sure. I do find that if I'm with somebody who's more anxious, I have to really be aware, because I can be anxious myself, and I have to kind of either spend less time or really just be aware of that, because it can affect me.
Yes. And you don't want everybody to be anxious. So somebody has to, stay mellow and calm and try to keep it all together.
Right. Are you familiar with the MyStrengthcom resource?
I am not, but I will check it out. Thank you for that. I'm going to write it down.
For sure.
It's a great resource. Thank you.
Yeah. Do you have any recommendations for activities for older parents who are shut in and can't go out because of COVID-19, especially as winter is starting and they're getting more depressed? Do you have anything that you recommend?
I honestly recommend trying to get them online some type of way, because I know that, sometimes older people struggle with technology. I think that trying to get the family together virtually actually lifts their spirits. Because they're able to still see family, they're able to see grandchildren, they're able to see their children. And so I know that with social distancing, especially for older populations, those with underlying health conditions, we're really trying not to go around them as much as possible. And so they miss people. They feel left out. Even if a group of the cousins get together, we're going to leave them out because they just can't afford to get sick. And so they feel excluded. They need to be included in some way. And so we definitely want to try to include them as much as we possibly can when we can. And then in terms of physical activity, it's very difficult because they have to stay in. So of course, if it's a way that they can get a treadmill at home, great. If they can spend 10 minutes on the treadmill per day, that's more physical activity than nothing. Or again, YouTube, I love it. It's a great resource for a lot of things. There are so many videos, exercise videos, workout videos, things that are fun. They can dance in their living room for 10 minutes, and it's not about hitting every step, accurately. It's about movement, period. And so it's a lot of things that we can do. We just have to really, really be creative and try to help the older people out a little bit, because they may not know where to start.
And you could probably do that together on Zoom, where if you found a video, you could dance with them, right? I mean,
yes.
You could make it like that. I know, I just share this with you because I think it was pretty valuable. I have a neighbor that has been playing games via Zoom. So there's certain board games or certain games you can kind of, I think a deck of cards wouldn't work, but things like if you both have dice, you could play dice games like Yahtzee or Farkle. There's things you could do. So if you have loved ones that like to play games, I feel like that might be another fun option that should be considered.
Yes, it actually works really, really well. My family did at the beginning of the pandemic. We had game night once a week, and we played games like Categories or Taboo, or, just different interactive games. And it was amazing. It was a lot of fun. And it helped us because at that point in time, everybody was staying at home. So everybody felt isolated. And so it really does. It works well. I definitely recommend it.
Very good. Well, I feel like we are nearing the end here. It's about, if there's any last questions, we can wait a couple seconds here. But Paula, thank you so much. This has been great.
Absolutely. Thank you for the invitation. I hope it was helpful. I really do.
It sure was. And tonight we're recording this presentation, so we will be sharing that link. It'll actually usually ends up on YouTube. Maybe Joe can pipe in here, but usually they put it on YouTube within a week, and they have their own YouTube channel. Is that right? Hey, Joe.
Hi, sorry about that. Apologies for not being able to join until just now. But yes, the RHPL does have these programs available on YouTube. They will typically be available about 1 week from today. So this should be available next Tuesday, the 17th. And we will also have another program with Ascension on the 17th. I believe that's the sleep program.
Yes,
correct?
Understanding Healthy Sleep. Yes, thank you for mentioning that. So yep, looking forward to that one as well.
Here, please join us again next Tuesday.
Yeah, Paula, I hope you can join us again. This was fantastic.
Awesome. Thank you, guys. Thank you so much for having me. Thank you so much.
Take care, everybody.
Thank you. Bye-bye.
Bye-bye.